I met a doctor she's not very old. I think she's in her maybe late 20s, early 30s. She was as nice as she could be. She was a resident, and she came in. She was going to be presiding over me and taking care of me while I was in. She came in and she spoke to me, and when she did, she asked me, how I wanted to be treated and how I thought I should be treated. She actually came in and sat down and took time to talk to me as a person. She treated me like I was an individual. She treated me like I was a person who had to get out of there, who wanted to be out of there. I love that. That just really made her stand out. She came and she said, Heather, when do you want to go home? And I was really excited about the fact that she asked me when I wanted to go home. She wasn't going to say, well, let's just see how it goes. It wasn't that she didn't ask me on the first day. She probably asked me on the second day, which is fine. When do you want to go home? And I was like, I think she asked me on a Tuesday, and I was like, on Thursday, I want to go home. And she was like, okay, we're going to try our best to get you out of here by Thursday. She listened to me. I feel like most of the time within the medical industry or the medical world of hospitals, doctors are so used to knowing what's best and what's right for you. They don't listen to the patients, especially for patients. If you talk to a patient and you can tell that the patient is not, who knows about themselves and knows about their bodies and knows how they work, if you listen, I feel like so many in the medical field, they don't listen. Not just doctors, but nurses as well. They don't listen. Jennifer was the first person in a long time, I can't be for sure in my years of experience, but who actually was like, what can we use to best treat you? I mean, a lot of them, I think, have done that in the past. They ask me what they can use, but then, of course, they always end up going off on the deep end and giving me something that causes me to have an allergic reaction or retain tons of water or whatever. She actually followed what I said, and I was like, wow, she's listening to what I'm saying. And I feel like that was also one of my most cognizant visits in the hospital. I was actually able to communicate. I wasn't all off in left field. I was actually able to speak to people and, look at people and remember. Like, I remember having a conversation with her in the morning. She came in one early morning. It was probably like 6 o'clock in the morning. My aunt was just getting to work, and my aunt came in to visit, and they ended up knowing each other. And I was like, oh, this is great. Everyone knows each other. And we're talking about the most random things, but it was like fingernail painting and shopping or something to the extent of. But it was the fact that my doctor was trying to relate to me as a person on a personable level. Like, hey, Heather, yeah, I realize you have a job. I realize that you have a life outside of here. So often I feel that I go in as a patient, or any patients go in, or any of the patients go in, they think, well, you're just here to get pain meds. You need drugs. You're here to get pain meds and treated, and that's it. I don't want to be here.